Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today we want to welcome Dr. Paolo C. Champion, MD. He is a urologist who graduated from Baylor College of Medicine and has over 20 years of diverse experience. He is a true leader amongst his peers and serves as Chief of Staff and Chairman of the COVID Committee team at Oak Bend Medical Center. Dr. Champion feels it is important for patients to be active in management of his or her urologic problem and patient education, which is the key component of his style. A proud husband and father who enjoys fishing, hunting, water skiing, and Texas A&M football games. Thank you, Dr. Champion, for joining us this afternoon.
Well, it's a pleasure to be here. Thanks for having me.
We tend to always lean to women's issues and children's issues and all these other issues. Today, we kind of want to include the men. And in things that come up as in topics, and men are notoriously, for not really expressing their concerns and answering questions. So we hope this is a great platform for them to get their education. So tell me why testosterone is so important for men.
Well, testosterone for both development for young boys as well as continued normal functioning of sexual function and well-being is an important thing. And most of the patients I see are not children, but they're adults. And what we mostly are dealing with is men as they age that have low testosterone levels. And so testosterone has a lot of obvious impacts on your health and some that a lot of people may not think are very obvious. Those can include interest in sex or libido, to some degree erectile function, but there are more factors that go into erectile function than simply having a low testosterone. But outside of the sort of sexual idea of what testosterone does, it has a lot to do with maintaining muscle mass and bone density or bone health, plays a role in your cardiovascular health, plays a role in simple how you feel day to day, getting overly fatigued, less mental motivation to do things. So it crosses over with a lot of things. So some of those less specific issues are also impacted by a lot of other factors like your overall health, your diet, your exercise level, your blood sugar, and a lot of other things. So it's not something that you can simply say, I have this symptoms, therefore I must have a low testosterone. It's often a component, but not the only thing.
So does it also affect infertility? Can it?
Well, low testosterone is not typically something that causes infertility, but you may see somebody with a certain type of infertility also have a low testosterone because the testicles produce both sperm and testosterone. So if you have something wrong with sperm production, there's a chance that the hormone signals, which are not working correctly to signal sperm production, may also not be working correctly to signal testosterone production. But having a low testosterone is not something that causes a low sperm count or infertility. And in fact, to emphasize that even more, the last thing that you would want to do if you're infertile and have a low testosterone is start supplementing with testosterone. Because what that will do is that will turn off your sperm production. So I've seen a handful of people through my career that have been for a fertility evaluation and were found to have low testosterone and were started on testosterone therapy, and subsequently, once we evaluated them, their sperm counts were nearly zero. And thankfully, getting them off the testosterone reversed that. And there are lots of other potential issues as to why that male may be infertile. So that's the relationship between those two topics.
Couple is going for infertility and the male is having some problems, to check with the urologist also?
Any question of fertility needs both parties to the situation checked. So the male needs to be checked by a urologist. The female needs to be checked by her gynecologist. Sometimes, in fact, quite often, the female will see a reproductive infertility specialist in the field of gynecology. But from the perspective of urologists, there's always both sides that have to be checked. Even if the female has identifiable problems, the male has to be checked. You can't just simply assume that everything is normal there.
Okay. What causes low testosterone?
Well, in the vast majority of men that we see, which are middle-aged and above, it's simply a matter of declining production levels with age. A small percentage of men will have hormonal imbalances that stem from somewhere further up the chain in the line of production. All hormones, and testosterone as a hormone, are produced by signals from other hormones. So when another hormone level is in the range that stimulates testosterone production, it's produced. So if somebody has unexplained low testosterone, especially if it's very low, or if they're a much younger patient, then you need to look at that entire hormonal system, as opposed to just simply identifying that the testosterone is low and deciding to maybe treat that, because you may find another thing in the axis that we call the pituitary hypothalamus axis, where you could have issues there that need to be addressed. So anytime somebody has the concern about a low testosterone, and oftentimes they'll come to us with a single or a couple of lab tests that show their testosterone is low, we'll go ahead and check a whole panel of other blood tests to make sure we're not dealing with something that we can have addressed and will take this problem out of the equation. The vast majority of men, however, when we do those tests, we don't find anything other than just diminished testosterone production. Very rarely will you have somebody who has failure of their testicles. That's usually a younger guy, and that's usually identified early on in life. But the vast majority is just lower testosterone production as a result of aging.
Okay, so speaking to that, I have seen a lot of physicians, really interesting OB-GYNs too, offering biomeds to men for low testosterone. What's your position on that?
Well, if you're referring to bioidentical hormones, that's sort of a burgeoning field. There's a handful of commercially produced bioidentical hormones that are FDA licensed, but the vast majority of what's out there are hormones that are compounded in compounding pharmacies. And there's no real FDA scrutiny over those. So you can have a formulation in one compounding pharmacy be different than another. I would caution people to stick with the things that we know, and we can predict how they're going to impact testosterone levels. The term bioidentical tends to try to imply that there's a superiority of that form of testosterone replacement with the other forms that are most commonly used. These forms are still man-made. They're not natural. They may be made from natural products, but a lot of prescription drugs are. But they are not actual testosterone that occurs in nature that's being given to you in a pill form or a gel or a cream or something like that. So the differences are that those are much less known as to their impacts and how they're going to affect your levels, whereas the more commercially available products and even compounded products that are the commercially available products are much more predictable as to how they're going to impact your levels.
You know, I was watching TV last night, and you see all these advertisements for ED and erectile dysfunction and testosterone, and buy this over the counter and do this if you're feeling this way. With what you said about cardiovascular disease, bone density, and everything else, I'm sure, and I'd like to hear your take on all this over-the-counter stuff and how it can, we've done a lot of stuff about these supplements that can get people in trouble.
Yeah, I think, you know, a lot of times people want to try and take their health into their own hands, which is great, but oftentimes it's done without a lot of guidance. And if the main guidance is marketing, then that's really not a very helpful way or a productive way to go about trying to help yourself. So you're right. There's no limit to things that are sold or marketed to us to try to sort of improve our lifestyle, if you want to describe it as such. And it's not just in the field of men's health or testosterone or erectile dysfunction. It's in all aspects of healthcare with our appearance and other, things that are going to make us feel better and happier and somehow give us a fountain of youth. So there's no shortcut around doing what's right and what's wise as far as figuring out what's going on. You can have a good, educated idea about what you think may be going on, but there's no real substitute for a professional evaluation and getting some tests done and then seeing if we can confirm what you think, or we may find something different. And most of the time, the more subjective complaints that people have are never going to be taken care of by one single solitary diagnosis and treatment. If someone comes to me and says, I'm tired and I don't feel like getting up and I'm not motivated and I've been gaining some weight. Well, there's a whole host of things that can play into that. And testosterone is not the only one. And I caution these gentlemen that even when we find a low testosterone in a situation like that, the administration of testosterone and getting your levels back up to normal may not be the entirety of the fix that someone needs. So doing our healthcare by what looks good in an ad, either online or on TV, certainly is something that can lead to less than desired results.
I agree. Do lower levels of testosterone affect the prostate?
The impact of testosterone on the prostate is pretty well known. Testosterone itself gets broken down to a chemical called DHT, or dihydrotestosterone. And that's actually what causes the prostate to slowly grow throughout our lives. I tell my patients that your prostate starts growing when you hit puberty and it never stops. And dihydrotestosterone is the chemical that is a breakdown product from testosterone that causes that growth. Now, one of the more common things that we think about and talk about in regards to testosterone and the prostate is the impact on prostate cancer. There used to be a huge concern that if somebody had prostate cancer, you could never in any circumstance give them testosterone. You have to be cautious, but there are circumstances where you can. We also used to be very concerned that giving someone testosterone would cause prostate cancer. Well, that's simply not true. There's still that misconception, but that's not true. Now, what that relationship may be in regards to prostate cancer is that if somebody has prostate cancer and you give them testosterone, especially bring their levels up quite high, you may make it grow faster than it would without being on testosterone. And the same thing if a guy has an enlarged prostate and you give him testosterone to improve his other issues, you may make his prostate grow further or faster than it would without the supplements. And they then may develop their symptoms of slower urination and trouble urinating more quickly than they would if they had not been on testosterone supplements. So the goal is always to manage things within a reasonable range, both prostate issues, prostate cancer risk, and men's well-being. But one thing I always tell gentlemen, don't be overly or excessively concerned about your testosterone, because no one ever passed away from a low testosterone. So I think it's one aspect of a man's health, but I don't think it should be sort of the overriding factor that men are thinking about. And sometimes we see that. Sometimes the other more common sense health measures are being ignored out of a preference for getting testosterone. Because the reality of it is you can give any man testosterone supplementation, even a man whose levels are in the normal range, and they're going to probably feel better on the testosterone. So the it's not a litmus test. It's not a proof that someone needed it because they felt better. Because you can take a guy whose testosterone levels is square in the middle of the normal range and give him extra, and he's going to feel better than he did before, just like the guy whose level was low and you got him into the normal range. So testosterone makes most men feel more energetic and things like that. But we also see on the flip side abuse of testosterone, and that's something that's become more apparent the longer I've been seeing patients for this issue. And I'll see fellas that are kind of doing their own thing and increasing their doses and having willing participants prescribe it for them, pretty much to the point where they're way above the normal range. So you have to be careful. That's something that unfortunately is out there. It's not real common, but we see it from time to time.
So women are advised to go to a gynecologist or get female exams once a year. Sounds like men should be doing the same thing with urologists.
Yeah, they should. The main thing for sort of the annual exam for urologists is screening for prostate cancer. And I'm not going to say that every man needs to come to a urologist once a year, once they hit the age of 45 or 50, because there simply aren't enough urologists in the world or in this country to see every single man in that category. But you start with once a year getting your primary care doctor to check your prostate and do a PSA, which is the blood test we use for screening for prostate cancer. And then certainly if there's any abnormality on either of those tests, come see a urologist and we can evaluate it further and see what the next appropriate step may be. So yeah, I think a focused urologic screening every year in conjunction with normal primary care screening things that are done. And that's important, and that's being done for the most part, but we still see, as you alluded to earlier, we still see a lot of men who don't go to the doctor at all. And so they're not getting any type of screening for anything. And those men need to have not just prostate cancer screening, but all the other common things that are important as we age, like heart disease and diabetes and colon cancer screening and those sorts of things. So yes, one way or another, a man should have his prostate checked at least once a year. When he hits about the age of 50, some organizations say as late as 55, others say as early as 45, determined on whether you have a family history of prostate cancer. But somewhere in that range, you should be getting a regular check of your prostate. Just make sure that there's nothing that's going on that's going to be worrisome for cancer.
Okay. So would urologists treat both men and women for a number of conditions, such as UTIs, kidney stones, ED, prostate, overactive bladder? And I know this is a broad question, but when should a patient see a urologist?
Well, I mean, I think in the ideal situation, most everyone has a primary care doctor that they see. And I would say if that's the situation that the patient is in, anytime the primary care doctor says, I think you need to see a urologist for this problem or that problem, I think absolutely. If a patient on their own, maybe they have a little bit more medical background than the average person, if they identify something that they think is related to the urinary tract, then absolutely make an appointment with a urologist. And that can be anything from kidney stones to urinary issues, for men, sexual issues, any problems with the way your genitals appear. If you see something or feel something that's not what you're used to as being normal, those are all reasons. We see a lot of self-referred patients that have had kidney stones in the past because most kidney stone patients know what their symptoms are like. They know that what they're feeling has a good chance of being a kidney stone. And so they'll often self-refer. But there's no dumb question and there's no dumb office visit that a patient could make that we would say, no, there's no reason for you to come see me. We may address whatever their concerns are. If it was a test result or a symptom, and we may say, I see that, but you're in good shape. There's nothing you need to worry about with that. Even though there is something that you've noticed, well, you're okay. You don't need anything else done. So,
and that's
even
the
that
biggest
is
peace of mind.
time. Yeah, it
Yes.
really is.
So some things can be so embarrassing for patients. Uh, However, I want to stress it's extremely important to discuss any problems with your physicians, and feel free to do so they can make an accurate diagnosis and help. Keeping secrets doesn't help. Would you like to add to that, Dr. Champion?
Well, yeah, I mean, I completely agree with what you're saying. I think in my field, there's a lot of things that patients will present to us for, and they don't feel comfortable talking to anybody about it. But I can tell you that as a urologist, there's probably nothing that a patient could tell me that I haven't heard or seen. Gentlemen often don't want to show me something, or they don't want to use the words to describe what's bothering them. And I try to tell them early in the visit, I said, look, there's nothing you can tell me that you need to be embarrassed about, because I've seen it all. I've heard it all. I'm the doctor that guys go to when they're embarrassed, so you don't need to be. And even occasionally some things that women are complaining of. So there's nothing that I or my staff could hear that we haven't heard before. There really isn't. And you can feel comfortable telling me or any urologist what's bothering you, and we can sort of help sort it out for you and figure out if it's something that needs to be addressed further, or if it's something that is perfectly reasonable and normal.
Letting things go can lead to a very bad ending. If you catch things quickly, sometimes things can be prevented. Dr. Champion and his staff are very professional, very open, and they do a lot of listening. If you're looking for a urologist, I really recommend Dr. Champion. He is a saint when it comes to treating his patients. Dr. Champion, is there anything else you'd like to add this afternoon for our audience?
No, I'd echo what your points have been here. I think it's important anytime somebody has a concern that they think may be urologic, if they're not certain, they can certainly reach out to their primary doctor or just make an appointment with a urologist. We'd be happy to see anybody that has a urologic problem or concern. And if we can help you, we will. Sometimes it's a matter of us saying, you know what, this isn't really a urologic issue, but I can tell you who you might need to go see to get further clarity on what it is that's bothering you. So I just think the important thing is reach out and get some help for whatever it is that you're concerned about with your primary care doctor or your urologist. And that way, like you said, small problems can be taken care of before they become bigger problems.
Dr. Champion, we will be posting your information on the website, and anybody that wants to know anything about Dr. Champion, they're welcome to call the numbers that we provide for you. I want to thank you, Dr. Champion, for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.